Good afternoon, everyone. How are you? This is Enrique Sanchez of Spanish United. Today we have a very special guest. Would you introduce yourself to the audience, please?
Hi guys, my name is Irina Yukabin. I'm an optometrist practicing in Southern California. I've been in practice for about 2 years now, and I graduated out of the Inter-American University in Puerto Rico.
Welcome. Thanks for being on the show.
My pleasure.
Yes, as we spoke previously, one of the things that we do in Spanish United is that we also like to encourage health, nutrition, because I feel that health is just as important as civil and human rights. And I heard that you studied and you became an optometrist. So in terms of the Hispanic community, uh, how important is eye health for the Hispanic community in general?
So it's definitely very, very important. And unfortunately, um, a lot of my Hispanic patients, don't know, they end up getting educated in my office. They don't know too much about their eyes, and therefore they don't know, that they actually need to have an eye exam, for instance, that they need to take their children for an eye exam. And sometimes, within the healthcare system, like the pediatrician won't tell them, or the pediatrician thinks that the child is fine when they're actually missing something pretty crucial to the child's development.
Mhm. And explain about the percentage that you would say that of Hispanics that have health issues primarily because they weren't able to afford or get their eyes checked.
It's actually pretty difficult number to put a percentage on. There, it's also important to understand that there are a number of issues that can come out of, not having your eyes checked, including things like headaches, vertigo, nausea, um, that are just coming out of eye strain, or health issues that are maybe missed and detected much, much later because there was no, annual examination. I don't have the stats off the top of my head, unfortunately.
That's understandable. So I would like to know what made you decide to get into optometry to begin with?
I do wear, glasses I did wear glasses as a child. So for me, I was in the optometrist office starting from a pretty young age. So I was exposed to the profession, and it seemed like a really good one, especially, when I was in college, just a couple years ago,
Mhm.
exploring careers. I think it was a friend of the family that, suggested to look into optometry, and it kind of all clicked together. It's like, yeah, I'm passionate about helping people, and I know firsthand how important it is to have, you know, that vision care and that eye care.
And what made you decide to study in Puerto Rico?
So one of my main motivators was the fact that I wanted to improve my Spanish. Coming from Los Angeles, California, I already spoke a little bit of Spanish. I learned it in school, but I wanted to sort of improve through, language immersion. Little did I know that there is quite a different, a different dialect in Puerto Rico compared to Los Angeles.
Well, yeah,
How, yeah.
my mom's from
However,
there.
Yeah. However, patients here do still understand me. They do mention that I speak with a little bit of what might be a Puerto Rican accent, which is something I'm actually proud of because that's where I really, work to grow and improve my Spanish as well as learning to take care of people's eyes.
Mhm. And you were in Puerto Rico for how long? For 2 years, 3 years? How long were you there?
About 3.5 years.
Nice, nice. And did you enjoy your time there?
I did, optometry is a pretty rigorous program. So a lot of the time was spent studying, but there were definitely a few weekends where we were able to, go to the beach or like enjoy La Placita over there. So it was a lot of fun.
Great. I'm glad you were able to enjoy yourself. Because one of the things that I feel that's very important is that people get exposed to Hispanic culture, and at the same time they see the positive side. Because, as you know, the United States has a lot of Hispanophobia in terms of stereotypes and stigma. So I'm glad that you were able to go to Puerto Rico and at least be fully immersed with the culture there. So I'm glad that you had a good impression of the island.
Yeah, I definitely did. And I actually spoke to somebody just the other day. I was catching an Uber to because I was getting my car fixed, and he had gone to Puerto Rico, several years prior. And he was like, I really wish I could go back. He's like, I miss it. So, and he was meant, and his primary draw was, like the culture and the people of Puerto Rico.
Mm-hmm. Yeah, right now Puerto Rico is going through a very difficult time, especially due to the economy and many other factors that the island is going through. And another thing I wanted to ask you, in the field of optometry, do you feel that if Hispanics were more aware of how their eyes can actually, I wouldn't say pre-diagnose, but to catch diseases early, do you think if people were more educated on eye health in the Hispanic community, that people would be more prompted and encouraged to get their eyes checked, let's say like once or twice a year? I don't know what they suggest, the optometrists that want you to check their eyes every year, but what do you think?
I do. I think awareness comes from education and understanding, how vision works and how the eye works and how that connects to your brain and how we actually see. So I do think that if people knew, what the risks were and what the potential long-term impact was, especially for children, but also for adults, they would be more likely to schedule an eye exam. Because I still see patients and, from the Hispanic community who are coming to their first eye exam at the age of 65. They've never had an eye exam.
Oh, wow. Wow, that's pretty something. Well, that is common, especially for like immigrant groups that have been here. Many of them never been to a doctor in their lives, primarily because they're not able to afford it because they're, undocumented. So yeah, that could really be something for a lot of people. And how would you say in your interactions with them, when they are being examined, like do they feel scared? Do they feel that it's strange? Because a lot of Hispanics, they don't really take the importance of getting their eyes checked. So it's like, from your experience working as an optometrist, like what's been your experience?
I actually have a range of experience. Some people are starting to, bring their children in because, maybe the school or the pediatrician recommended it. And the patients that do get their first eye exam very late in life, there's definitely a level of apprehension because, for the first time ever, they feel like they're not seeing the way they saw before.
Mm-hmm. All right, that makes perfect sense. So in your field, when you are examining patients, like what are the key factors that you look for? Because I'm not an optometrist, so Spanish United likes to know, and our listeners, what are the things that you look for when they train you, and when you are doing what you're doing, like what are the things that you look for, like in someone's eyes when they're being checked?
Yeah, absolutely. So there's definitely different types of exams depending on the patient need. I'm going to walk you through sort of a standard, eye exam. So the very first thing we do is we take a case history. We really need to know, um, you know, how your eyes have been in the past, and also how your health has been in the past, what medications you're taking,
Mm-hmm.
because those can both, those tell us what conditions you have, but they also tell us, some medications can actually have an effect on your eyes.
Really? I did not know that.
And so there are certain medications that can kind of deposit in the clear area of your eye called the cornea.
Mm-hmm.
So sometimes even before I look over the medication list, if I'm kind of looking at the patient's eye first, I see that.
Okay.
Or if the patient forgot to put it on the medication list, which unfortunately happens more often than not, and amiodarone is not an eye medication. It is a heart medication. So it doesn't matter that the medication is not for the eyes. We still would like to know that, what you're taking.
Mm-hmm. Okay, I
So,
wasn't aware of
so starting with that, we're checking, your visual acuity, which is basically how small of a letter you can read from a distance.
that. Mm-hmm.
And we do that, each eye individually and as well as both eyes together. We're checking your eye alignment and your eye muscle movements. We're checking your pupils. We want them to also, be working together correctly. Depending on, some doctors will also make checking like the focus and like the focusing system and the binocular vision system in a little bit more detail as part of their exam. Sometimes it's sort of like a separate subset because we're so focused on making sure that you have, your prescription. So we're checking your vision to get an estimate of your prescription. And then we sort of fine tune it with you to make sure that it's comfortable. Mm-hmm. We're also checking your eye health. So your eye pressure, what we do behind the slit lamp, which is sort of like a giant microscope, as I explained to my pediatric patients, is we're checking everything from your, eyelids and eyelashes to the very back of your eye. And this is also why we want to dilate the eye, because that dilated view lets us see things that we cannot see, otherwise.
Mm-hmm. Right. And when there is an issue where there is a concern of a disease, like what comes out? Like, does it come out like a tumor? Is it like little holes, or is it like an inflammation? Like, if there's like an issue with a person's, vision or their health, and you spot it, like, how do you identify it?
So it can be any number of things. So in addition to actually looking at the eyes, we do look at, the whole patient. So we're looking at facial symmetry and their gait and their field of vision. So if I see my patient bump, into things in the waiting room or on their way in consistently, they're getting, their field of vision checked a little bit more. And I'm wondering if, they've had maybe a stroke in the past.
Mm-hmm.
But it can come up as a number of things, from like little mites that like to live in your lashes to, if you want to focus on the back of the eye, I think the biggest things we see are, bleeding from either diabetic retinopathy
Mm-hmm.
or hypertensive retinopathy. We do have some tumors that will show up in the back of the eye. And we definitely want to catch those as early as possible so that we can treat them as early as possible. Because for those, the success of treatment depends on how early you catch it.
Oh, of course. Absolutely. So, it could definitely be life-threatening if these things cannot be caught on time. Am I correct?
Yes.
Wow. it's really something. And explain the organization or the group that you're part of that's called Leo, Latinos in Optometry. Can you explain a little bit about that?
So this is actually a very new organization. I am not part of it yet. I don't know if they will allow me to join, but I am meeting with some of their members this week. So Latinos in Optometry is founded by several Latino optometrists who want to make sure that the Latino community is represented and to help ensure that there are more Latino optometrists.
Mm-hmm. Because that's something that is lacking in the Hispanic community in general. Medical professionals of every field. It's like the largest patients are actually Hispanic in general, but when it comes to the number of medical professionals of any field, that doesn't matter what it is, it tends to be in the very small minority. So I definitely commend Leo, the Latinos in optometry, for try to encourage more Hispanic and Latino optometrists to be in the field, because like I said, there is a need, especially in the Hispanic community, when it comes to health and it comes to optometry, because we just don't have it.
Absolutely, yeah. And we are now, as the optometry community, working a little bit more actively towards ensuring that we have minorities of all types in the optometry field.
Because I feel that if there are more Hispanics that they can relate to, I think more Hispanics would be more encouraged to get their health checked more often. Like, another reason why a lot of Hispanics don't really go to the doctor primarily is because a lot of them don't speak Spanish. I mean, don't speak English. I'm sorry, that they don't speak English. So it's like, when there's like a language barrier, it's kind of difficult to try to explain, to the best of your ability, the symptoms that you have, what's going on with you, and then finding a way to treat it. Because doctors that don't speak the language can only do so much.
Absolutely, yes. And I think so where I'm currently working in Bakersfield, we do have a lot of our technical staff who do our workups, but they also sometimes serve as translators for other doctors.
Mm-hmm. I haven't been to Bakersfield in many years. I can imagine that it's changed. Like, I've only been there like once in my life, but this was like long time ago, like back in the 80s.
Oh wow, yeah. So it's probably changed a bit.
Yeah, like when I think of Bakersfield, I think of the band Korn. That's about it.
Yeah.
Because that's where they're from. And I also wanted to ask, as a optometrist, like, what would you like to see different in terms of Hispanics having better access to optometry care?
Honestly, a lot, and that sort of starts with just ensuring that everybody has better access to care, especially our low income patients. So I think one of the biggest first steps, so the first step is making sure that the community is aware that they do need an eye exam. So the American Optometric Association recommends that children receive their first eye exam at 6 months, 3 years, and 5 years, and then every year or every other year when they're in school.
Mm-hmm.
And it's about every other year for adults. But unfortunately, insurance companies will sometimes say, well, you know what, we're going to only cover the glasses part of your of the exams, or we're only going to cover the medical part of the exam. So
So why is it that you believe that many insurances don't cover it? Because they consider it cosmetic? Do they consider it not essential? Like, what's the reason why they don't cover it like everything else?
so with eye care, we have, the medical insurance and vision insurance plans like VSPs and IMED. So VSP and IMED typically are more focused on vision care coverage as far as I know, and that's your, just checking for your prescription and the glasses. Whereas if there's something more medical and you need to do testing, you're often billing medical insurance.
I
But
see.
right now, one of the major challenges for just optometrists in California in general is the fact that Medicaid reimbursements have actually stayed the same for the past, I think, 20 years or something crazy like that.
Hmm.
So we have the fourth biggest economy in the States, but our reimbursements are, I think, the third or fourth lowest in the
Right.
US.
Right. I agree with you. And for California, for being the largest economy in the United States and the fourth economy in the world, California could definitely do better, you know. And I think a lot of it has to do with red tape and bureaucracy. And one of the things that we do in Spanish United is that we lobby, particularly like with government and different institutions, to make reforms, especially in relations to the Hispanic community, because we are the largest minority in the country. We are the ones that are primarily responsible for the economy, especially for the services sector. But we have a lot of invisibility, you know,
Mhm.
and I feel that in order for to have a more productive society, there needs to be services available for those that need, especially those that are, you know, helping the economy. Like, it doesn't matter what people say, if people that are Latino or Hispanic or undocumented or not undocumented, they are contributing to the economy in some way. So I really feel that there really needs to be more resources put, particularly like in health, because I feel that,
Mhm.
you know, if there was preventive medicine, it will definitely cost a lot less money than for people that they just get sick and then they get really bad and then they have to pay a lot of money out of pocket, because that's the argument that a lot of conservatives have. It's a lot of money, it's wasteful money. Okay, I understand that, but if you invest in preventive medicine and have services for people that they could find ways to prevent themselves from getting sick, you know, being more healthy, exercising, you know, getting, like you said, these exams that function as prevention, so that way they could catch something early, then people don't have to pay so much money out of pocket, because the United States is the only country in the entire developed world where we have the highest premiums, we have the highest insurance rates, where people don't have universal healthcare coverage, and people have gone bankrupt and ended up homeless because they cannot pay their medical bills. So that is something that needs to be reformed, because in the long run, it affects everybody, including the economy.
No, I absolutely agree. You have, people who are putting off visits because either they can't afford it or, they're not aware that they're supposed to do this. And then when they do come in, it's a really unfortunate outcome. Now this person is relying on the government to make a living because they cannot work.
Mm-hmm.
So
So,
ultimately, that actually costs the government more.
mhm. Because let me tell you, I've been to other countries where they have a universal healthcare system, and even though they may pay, you know, more in taxes, but the people are encouraged and they have a safety net that they don't have to worry about, you know, if I get sick, how am I going to, you know, afford to pay my bills or whatever. But they also believe in preventive medicine, like for example, in the case of Britain, um, you know, a doctor of any profession, doesn't matter what it is, they receive their salary, which is a good salary, but they have something that's called the bonus system. So let's say for example, if they get a patient to lower their cholesterol, the doctor will get paid more. If they get a patient to stop smoking, the doctor gets paid more. If they get them to start exercising and eating healthy and being more active, they get paid more. So the doctors are actually paid to get their patients to be healthy. On the opposite of the United States, that, and this is my opinion, I'm not saying that it's, fab, but many people will agree with me that the doctors, they want the patients to be sick because, the more the patient goes to the doctor, the more money they get from the insurance. But remember, we have a profit-based system of our healthcare system. So, and I feel that's the reason why it costs so much money, because it's privatized. Insurance companies can charge whatever they want, and then the one that has to pay for it is the patient and the taxpayer.
Well, you've actually touched on something pretty important, which is, in addition to the important point you made, which is compliance. So when I, as a doctor, see a patient and say, hey, you have this condition, you really need to be using these drops consistently. Sometimes the patient does not do what I prescribe.
Right.
And unfortunately, this actually happens, a significant amount of the time, whether because there's a cost barrier, like you said, with medications being really expensive, or because they lack understanding, or because they're lacking trust.
Mm-hmm. And I feel that, it will get there, that it will reform, but it's gonna take time. And again, people are finally waking up, and people are finally understanding that that healthcare, especially when it comes to the provider, is essential for the viability of an economy. So as long as people are starting to understand and realize that, I feel that we're going to go in the right direction in this country. We are already at the end of our time. I want to tell you, Irania, thank you so much for being on the show. I know that we've been back and forth trying to find the day, but we finally were able to do it, and we were able to cover all the subjects for the podcast. And as soon as I'm done, I will email you and text you the link, and you could share it to all the platforms. You can share it to Leo, and if you have anyone from that foundation that wants to speak with me, like in the future, please don't hesitate to contact me.
Absolutely. Thank you so much for having me on. Honestly, there's so much to cover for eye care that I do hope that you're able to connect with Leo and, other organizations that even I'm involved with, just that are dedicated towards educating people about the importance of eye care, including the Hispanic community. So
absolutely. And for your listeners on your side, we are on social media. We are on Spanish United Facebook, Spanish United Instagram, Twitter, and YouTube. We also take donations via PayPal and Cash App. It's not mandatory, but any donation is appreciated. And anything that you give goes directly to someone in the Hispanic community or anyone that is in need. So you don't have to be Hispanic to receive any type of assistance from Spanish United. Have yourself a wonderful afternoon.
All right. Bye.
Bye-bye.